Hello, I'm Christy Joy, a nurse in Cape Town, South Africa, the place where PAC was created and developed. I'm going to be facilitating an on-site training session today, and I would like to invite you to join us. Today we would like to show you the PAC approach to on-site training. We will also discuss facilitation skills and adult education principles related to the PAC program. The complete video lasts 20 minutes if you watch it straight through, but we have suggested places to pause and discuss important points with your colleagues along the way. Our training model is based on an educational outreach approach, so I'm preparing to run an on-site training session with a group of nurses who work in a clinic. If possible, arrange your seating around a table, then prepare your materials and attendance register and greet your participants warmly as they arrive. Good day everyone, welcome to our session together. How are you all doing?
Good. Okay.
Yeah.
Fine, thanks.
Thank you for coming and making the time. So before we get started, I just want to remind us of our group norms up there behind you, Claudine. We want some participation, please, sharing experiences, time management. We've got an hour and a half together for this session. Cell phones off, everyone checked. We'll respect each other and our experiences that we're going to share. Listen to each other, and we want to have a bit of fun.
Yes.
Before we get started with our case, I'd like to know, have you been using your patient management tool in the clinic?
Yes, I've used it for the diabetes management. Yeah.
Oh, wonderful. Great. Is anyone having any problems using the tool?
Yes, you know, the HbA1c blood test is something new that we have to do now for diabetes, and all systems are not in place.
Would it be helpful if I spoke to the facility manager to inform the rest of the staff about that?
I think that will help. Yes, thank you,
Okay.
Christy Joy.
Super, I'll do that. Okay, today we're going to start with an introductory case called Jack. And you've all got your patient management tools ready. Jack, in our waiting room scene. Here is Jack. Can you all see him?
Yeah.
Yep. What does he look like to you?
Tired.
Tired?
He looks in pain.
Okay, so Jack is 28 years old, and he comes in complaining of worsening face pain for the past 3 days. Where in our patient management tool are we going to go?
So we'll start on the contents page.
Is that not face symptoms?
Yes. So, what page is face symptoms on?
13.
Good. Yes, let's all go to page 13. Right. Are you all there?
Yes.
Does Jack need urgent attention?
Does Jack have one-sided facial weakness with any involvement of the forehead?
No, there's no obvious facial swelling or weakness.
Does he have any facial swelling or difficulty breathing?
No, his breathing is normal.
Okay. Okay, so that means that we don't need to check the urine dipstick, so we can skip those next 2 lines.
What is his temperature?
His temperature is 37.2, so it's normal.
According to this, it doesn't seem as if Jack needs urgent attention then.
Good.
Yeah.
No, Jack doesn't need urgent attention. Right, so where do we go from here?
Okay, I see that approach to client with facial symptoms not needing urgent attention.
Good. Are you all following on the algorithm?
Yes.
Yes.
Good.
Does Jack have any jaw or cheek pain with or without swelling?
All right, his gums are red and swollen on the right side of his jaw.
Okay, so that means that he's got gum or tooth infection likely.
Correct. Do you all agree?
Yes.
Yes.
Yeah.
Everyone following?
Yes.
Right, so how are we going to treat that infection?
So we're going to give paracetamol 1 gram 6 hourly as needed for up to 5 days. And we're then going to give him amoxicillin and metronidazole. And what's quite interesting here is it says if he's allergic, then you must give azithromycin. And I, for the first time the other day, had a patient who I gave amoxicillin to, and they actually had an anaphylactic shock in the clinic.
Wow.
It was the first time. We hear about it often, but it was actually the first time that I've ever seen it happen. And we had to give adrenaline and sort them out. But it's quite interesting for me that it actually says it here.
Good. Right, what else do we still need to do for Jack?
Referring to the dentist.
Good. Jack needs to go to the dentist. Do we all agree?
Yes.
Right, fantastic. You've all managed Jack very well. So to summarize, he came in to the clinic with face pain that had been there for 3 days. We started in the patient management tool by going to the contents page. We looked for a symptom, which took us to page 13, face symptoms. Right? We established he did not need urgent attention, and then we followed the algorithm and we decided that he had a gum or tooth infection, and we treated him for that and we referred him to the dentist. All agree?
That's correct. Yeah.
Okay, but I'd like to use this opportunity to also familiarize ourselves with another part of this page. So, let's say Jack arrives, we establish he doesn't need urgent attention, and he says that he has pain over his forehead or on his cheeks. Where would we go in the patient management tool then?
We will then check the next column, which says pain over forehead or cheeks, worse on bending forward, and or pressure over sinuses, and or pudulent nasal or postnasal discharge.
Good. Do you all see that block?
Yes.
Okay. So, what is the likely diagnosis there?
And then we look at sinusitis likely.
Right. So, what treatment would we give to Jack
The
then?
treatment is paracetamol 1 gram 6 hourly as needed for up to 5 days. And if symptoms for more than 6 days, we give amoxicillin 500 milligram 8 hourly for 5 days. And also if allergic to penicillin, we give azithromycin 500 milligram daily for 3 days instead.
Right, and then what we see there is a list of possibilities he might need referral for. Can we each have a turn to look at one of those?
So the first one is associated tooth infection.
If there's a poor response to treatment,
Swelling over sinus or around eye.
And when there is any signs of meningism.
Sorry guys, I forgot, what is meningism? Can you explain please?
That's a good question. Can anyone help us?
Isn't that when someone's got signs of meningitis? So like if they've got a stiff neck or a severe headache.
Good.
Okay.
Does everyone agree?
Yes.
yes.
Thank you.
All right, so the next reason for referral?
It actually says here, if sinusitis is recurrent and status unknown, test for HIV. And I must really confess, guys, I had a patient that had sinusitis 3 times last year, and I never referred him for HIV test.
Thanks for sharing that story, Dee. I think we can all agree that that's an important thing that we need to do. It's a key message we need to bring across. So that arrow there that we see there, Deanna, what does it mean?
It's actually a boomerang arrow, and it means go to page 64 and come back to this current page.
Good. All right, what do you find on page 64?
HIV diagnosis.
Good. Are you all there?
Yes. Yeah.
So this is the page in the patient management tool that we would use to test Jack if we are suspecting HIV. So we would work through this algorithm, and then where would we go once we've tested Jack?
We would then go back to page 13.
Good. Okay. So that is another option on this page of face symptoms that we have familiarized ourselves with now in this session. Are there any questions? Good.
No.
Oh.
It's clear.
So in summary, what did you learn from the case of Jack?
So we learned how to go from a symptom page and follow the case through and find out how to diagnose and treat Jack.
Good. So we started with the contents page and it took us to the symptom page.
It's also important to exclude that the person is not a medical emergency.
Yes, very true. We went through the red box and we checked that Jack did not need urgent attention. Thank you.
It actually shows us also that each and every patient should be offered an HIV test.
Yes. That's especially what you've learned today, Deanna.
Yes, definitely.
Good. So I'd like to thank you all for coming and for your contributions and for sharing. I hope you've enjoyed the session. So our next session will be at the same place, same time next week. Is that okay?
Good.
Okay.
Please will you remember to bring patient folders if you have any interesting cases that you would like to share, and then we can use the patient management tool to work together. Stop and think back to the 4-step approach to on-site training. Which facilitation skills were modeled during the training? Please pause the video now for a group discussion. We will now highlight some key facilitation skills. On our waiting room scene, this is Jack over here. Can you all see him?
Yeah.
What do you think about Jack? How does he look?
Okay, so that means that he's got gum or tooth infection likely.
Correct. Do you all agree?
Yes.
Everyone following?
Yes.
Yeah.
Right. What else do we still need to do for Jack?
Referring to the dentist.
Right. Fantastic. You've all managed Jack very well. So to summarize, Jack came in with worsening face pain and we went to the contents page in the patient management tool. From the contents page, we went to the face symptoms page on page 13. Then on the face symptoms page, we established that he did not need urgent attention, and we came to the diagnosis of a gum or tooth infection. We treated that infection and we also referred him to the dentist. Turn to the person next to you and take a few minutes to discuss which adult education principles you observed being modeled during the on-site training session. Please pause the video now for a discussion. We will now highlight the 5 key PAC adult education principles. Adults learn by doing. Working with practical cases brings the training to life. Adults learn well when they feel respected. Treat each participant as an equal. Adults bring experience and knowledge into learning situations. Encourage participants to share with each other. And in light of the previous point, the facilitator does not need to be the expert. Draw on the experience of the group. And lastly, learning must be relevant and goal-orientated. Adults should be able to apply new knowledge in their current context. This brings us to the end of the PAC training video. We hope that it empowers you on your PAC journey. Thank you.